As a nurse, Beata was very thorough, so she documented every doctor visit from the very beginning. But they just put their arms up in the air and said, there's nothing we could do.
And one of the problems of being very thorough is that can also get you labeled as a pushy parent or someone who's pushing for a diagnosis and won't accept no for an answer. So already I'm beginning to see where this might be going, where mum is considered pushy, mum won't accept no for an answer, mum won't accept the diagnosis that other doctors give, and mum is looking for a specific diagnosis. And next thing you know, people get very concerned about why is mum being so pushy. The corollary to that, of course, is that mothers want the best for their children. If they feel that the doctors are missing something, of course they're going to push and push for the best of their child. And determining which of those two is what's happening can sometimes be very difficult.
Yeah, and with the like her being a nurse.
That's the other thing. Pseudo seizures and an awful lot of functional disorders, pseudo epilepsy and epileptiform disorders, they're more common in nurses, and they're also more common in the families of people who have that disorder in the family. So one of the things that happens with nursing staff is that I've seen quite a few nurses who have presented with seizures which weren't epilepsy, and who've presented with kind of very vague symptomatology and often kind of very weird symptomatology, which is what this is as well. So if you're looking at it, I can totally see why you'd be thinking, is this nurse using her medical knowledge to create a narrative of illness in the child? But again, that's less likely than the child actually really being ill.
So I was going to say, with her being a nurse, she might be more keen on what to look for when it comes to symptomology of these sorts of things, realizing there's something significantly wrong.
Oh, absolutely.
And it may lend to her being pushy because she realizes, like, this isn't just something she's making up. This isn't psychological. This is real.
Well, and also with a nurse, she's going to be live to the fact that if it's vague symptomatology and the doctors can't diagnose it easily, it doesn't mean it's nothing. It just means it could be something unusual but still very serious.
Yeah, and therefore note-taking is especially important.
That's exactly the first thing I would do if a child of mine had vague symptomatology and couldn't be easily diagnosed is I'd start keeping a good record of the symptoms and the signs and the vitals. And I would absolutely be going into the doctor and I'd be printing out pages and pages of stuff, because I'd be like, the more information you get, the better a judgment you're going to make. I sometimes say to my team and patients, as your consultant, I am a decision-making machine, and the better the information you give me, the better decision I'm going to output. And she would have known that. But again, I wonder, or I suspect I should say, that she just came across as pushy, and that then they started questioning why she was doing this.
Okay.
We don't know what it is.
You know, I hear your story. I understand she's been going through a heck of a lot of stuff, but I'm still not certain of what we're dealing with, to be honest with you. Because a kid can tell you, I can't breathe, and I don't know, she's gonna have an anxiety attack.
Well,
so, you know, there's a lot of things that are question marks. Just give me 1 second.
It's not anxiety.
I know, baby, I know. He's just trying to figure it out. You just stay as calm as you can.
And you can hear that the doctor is being quite open with them about the fact that he doesn't know what it is. There's a lot of things which are question marks, and it's vague symptomatology which isn't leading to a clear diagnosis. And mum sounds very exasperated by the whole thing as well.
We knew as parents something was wrong, and they are not doing enough. So when Beata got home, she didn't go to bed. She researched. And that's when she ended up finding Dr. Kirkpatrick.
Okay, Maya, is it okay if we can use this video to educate other children?
Yeah.
Okay, good.
It's always nice to see someone give a child agency by asking for their consent. But in recording this, he should have followed it up by asking mum for her consent as well, because Maya isn't of an age to be able to give informed consent. So that informed consent actually isn't valid.
yeah, it's very possible though that
yeah.
they asked mom first.
I would hope so, but it's just a thing that strikes me because I've recorded interviews with adults and children before, And I've always been very careful to get the guardian on tape as well if I'm consenting a child.
So let's go over your history just a little bit, okay? Approximately 3 months ago, you started having some pain down in your feet here, okay? You see how her legs are turning in? We call that dystonia, okay? Dystonia. In fact, it's so bad right now, she can't even bear weight safely, okay? You ready for some testing?
Yeah.
Okay, take that right hand as best you can and see how far you can get it before you have to stop, okay? That's it right there? Very good, Maya. Now, the next thing we're going to do is going to ask your mom to help you. She's going to get over here, and she's going to hold your foot up and try to wiggle your toes as best you can, okay? Can you try that? You giving it everything you got there? Okay, Mom, you don't see any movement, do you?
No.
Okay, Mom, very good. Good.
It's funny that the training is clearly the same in America as here, because I default to calling the parent of a child mom or dad. And
Part of your training?
yeah, it's part of the training. And he defaulted to talking to the mother instead of her name. Do you see any of that, Mum? Do you see any of that? Yeah, so some things never change.
So do they actually instruct you to say mom when you're referring to a patient or dad?
To their parents. Yeah, they would. A lot of it, though, is mirroring. Like when you're in training, your senior colleagues and your mentors will call them by that name, mom, dad, or lady, gentleman, or whatever. And so you mirror. But if you did start calling them by the name, Mary or whatever, I think people would pull you up. Like certainly if a doctor I was training started referring to the mum of a child on a first name basis, I'd probably take them aside and say, look, that can be misconstrued. You want to be a bit careful there. Maintain your boundaries, maintain your role, maintain your distance.
Being misconstrued.
In psychiatry, if you start calling someone by their first name and they could deem it to be inappropriate, they could deem it as a pass, they could deem it as permission to make a pass on you, they could deem it as an attempt by you. And I've had this happen where they say, doctor, you can call me by my first name, but I can't call you by your first name. This is bullying. And then you get a complaint made against you.
So with your adult patients, what do you refer to them by?
It's different. When I first see them, I refer to them by Mr. or Mrs. and their surname, or Ms. and their surname. And then if I've known them for a while, I have several patients who I've been treating for 10 years at a time. Then at some point I will start calling them, by their first name.
So would it be appropriate then for a doctor to refer to child patients' parents by Mr. or Mrs.?
Oh, yeah, you could do that as well. But this is the intake interview, so he's being formal. And once he's seen her 3 or 4 times, he might start calling mum or dad by their first name when he's talking to them. But it's just interesting to see that kind of the procedures are the same everywhere you go.
It was obvious what the problem was with Maya. It was clear and simple: CRPS, complex regional pain syndrome. What is complex regional pain syndrome? The best way to think about it is the way it evolves. Let's say you have an injury. What happens in these patients with CRPS is that it actually intensifies over that period of time.
Published case studies indicate that the incidence of CRPS increases dramatically between 9 and 11 years old, and it is found predominantly in young girls.
The patients describe it primarily as a burning sensation, that their skin becomes exquisitely sensitive to light touch.
Picture a floating feather, soft to our touch. Patients say this feels more like a knife stabbing their body.
Okay, so does this align with your understanding of CRPS, and what's your experience treating patients with CRPS?
Yeah, I've had a lot of patients with CRPS. About 90% of it is post-trauma, just like they described. And then about 10% of it can occur de novo without any, pathology affecting the limb. And what they showed there in the hand is very typical. You get an injury to one limb and you get pain in that limb. It's a little rarer to have it all over the body. Appears to have happened in Maya, but again, you can have strange presentations of these things. And some of these, the 90% which follow an injury, are probably going to have a different pathology than the 10% which follow no injury. And I wonder, might they be systemic or autoimmune or anything like that? And actually what they were talking about before was very interesting, about being told that this is psychological And what they're talking about there is a psychogenic either conversion syndrome or somatoform disorder. And what that means is psychogenic is psycho and genic as in genesis, so arising out of the mental aspect of the person. And conversion disorder is where you're converting, I suppose, emotional and psychological trauma into physical disability and pain. And that can often happen if the person, for whatever reason, doesn't feel that their mental distress is going to be recognized or accorded the respect it deserves. And so they may often then evince it as a physical disability, or else they're not even able to admit to themselves that they're under mental distress. And so the only way that their mind can get them to take a break or to stop doing whatever is to make them physically unwell. And I remember a really clear case of this when I was a very junior doctor. I think I've told you about this one before. There was a lady who came to my clinic after Christmas, and she said, "Oh, doctor, it's really good to see you. It's really good that my appointment was this week and not last week because I was in hospital." And I said, "Why were you in hospital?" And she told me that she'd spent the previous 3 weeks hospitalized with paralysis down the entire right side of her body, right arm, right leg, right side of the face. And the thing is that if you've had a stroke, it should be the left side of your face and the right side of your body that's paralyzed. It should be the opposite side of the face because of the innervation of the cranial nerves to the face versus peripheral nerves in the rest of the body. So it didn't really make sense. And so I was asking her about what was going on around the time she came in, what was going on around the time she left hospital. And it turned out that her own mother was due to visit her on the day that she was admitted to hospital. But she'd had to cancel that this year because her mum had had a stroke the year before. And when her mum had the stroke, she said, "I won't be able to care for you if you visit me for 3 weeks." So she said, "You have to stay in the nursing home." And she felt very guilty about that. And so then I said to her, "Well, can I just guess? Was your mother paralyzed on the right side of her body, a hemiparesis, right hemiparesis?" She said, "Yes." And I said, "And can you tell me what were the days she would have visited?" And it turns out she got paralyzed on the day that her mum would have visited, and the paralysis lifted out of nowhere on the day that her mum would have left staying with her. So really her guilt over it was converted into a physical paralysis because she was unable to really deal with the guilt. So it's a very powerful illness, any conversion disorder or somatoform disorder.
I know that you treat mostly adult patients.
Mhm.
Have you treated any minors that have CRPS?
Yeah, a couple. Most of the minors I treated had anorexia, other eating disorders, suicide attempts, homicide attempts, drugs, anxiety, autism, depression, that kind of stuff. But yeah, some with regional pain syndromes, yeah. Not that many though, mostly adults.
And I assume not quite as severe as this case.
The ones I saw would have been in the National Children's Hospital for my country. So they were the tertiary level referrals. The GP and the local hospital weren't able to manage them. And so they came to the specialist center there. And I was one of 2 psychiatrists in that hospital for some time. So I saw a lot of terminal kids and very seriously ill kids. It was a very tough job to do.
We had to right away get aggressive with and get under control. We've treated over 3,000 patients with complex regional pain syndrome. And we know what the best therapy is for it. It's called ketamine.
So what's your opinion of ketamine? Have you prescribed ketamine, and do you think this is an effective treatment?
Special K. I'm not in favor of it when bought from your friendly local street dealer. I don't think that's really a therapeutic modality in those cases. No, look, in all seriousness, yeah, I think ketamine shows an awful lot of promise. I think hallucinogenics in general show an awful lot of promise for depression, anxiety, PTSD, and so on and so forth. And certainly I'm personally in favor of testing psychedelic-assisted psychotherapy and therapies. With that said, look, if the research is there for ketamine and complex regional pain syndrome, then absolutely go ahead and use it. There's a joke that we used to tell, which is that the 3 levels of you're going to be sued for this decision are when your consultant or your senior says, 1, that's interesting. That's, you might get a complaint, you're probably not going to get sued. 2, that's a very brave decision, which is you're definitely getting sued for this. And then the third, which is like absolutely contact the lawyer immediately, is when they go, could you explain your rationale for that decision? Because that's no longer even brave. That means I don't understand just how the hell you decided to do this. And explain it to me, and then write it down with a lawyer present and go over that. I think this is what I'd say is a brave decision. And I think it's innovative, which is, again, a very worrying word. Brave and innovative. And the other damning with faint praise is, I'd love to see some audited results, which is basically, yeah, I'm going to check he didn't fake the results, and I'm going to wonder what they are. But no, look, I'm sure there's a good evidence base for this in this case. Plus, medicine only advances when people are willing to try new things.
Ketamine is a safe, effective treatment for advanced complex regional pain syndrome. Because when the ketamine gets into your body, it actually stimulates the brain and kind of resets everything. It tends to increase your blood pressure, increase your circulation, and increase your breathing. With Maya, we first tried the outpatient procedure at a relatively low dose.
Does it cause any pain?
But it was not working. So I discussed with the mother and with Maya the idea of the ketamine coma procedure.
Wow, ketamine comas. Any time that I hear medical treatment which involves the word coma, I go back to insulin comas and diabetic comas that we used to use for psychosis and mania and stuff like that, which work really wonderfully well for the roughly 90% of patients who survived the coma, but were significantly less beneficial for the 10% who used to die. And I'm sure they don't have that here, but ketamine coma is, I think we're now beginning to verge on, could you explain your reasoning and your rationale, rather than it being a brave decision.
Some patients are taking control of their pain by going into a coma. Here, doctors use up to 50 times the typical dose to induce a 5-day coma.
Dr. Kirkpatrick says the experimental treatment is only available in Mexico.
What do you think of the fact that this experimental treatment is only available in Mexico?
To be honest, I'm a little glad that they said that, because a part of me was just thinking to myself that perhaps I needed to hit the literature and start reading up more on CRPS and ketamine, because it really isn't where treatment is as far as I'm concerned. But things evolve, and I haven't really read up on it so much in the last couple of years. But to be fair, once they said this experimental treatment is only available in Mexico, I kind of went, yeah, fair enough. I think my view was correct. And a 5-day ketamine coma? Wow.
When this was told to me that we would have to go to Mexico, I was in disbelief.
Flat on your back like that for so long.
And then he told us that there's a chance that she could potentially die.
I have a feeling she's going to do well. Very well.
Yeah, I should bloody hope so. I should bloody hope that he wasn't going to recommend a 5-day ketamine coma which could kill her, unless he was pretty damn sure it would really benefit her. Wow. Gee, my practice is not this brave and innovative. I guarantee you that. I'm a lot more old-fashioned than this guy.
It was very scary, but there was no other options. It was that or see Maya deteriorate every day. So we decided to take her to Monterrey, Mexico.
I will wake up.
Yes, you will wake up.
Here's coma day 1, Wednesday, November 18th. Maya is doing well.
Today is Friday, November 20th. This is day 3 coma. Maya is doing great.
It's coma day 5. She had a bad episode this morning of vomiting, so they had to give her extra ketamine.
I just think it'd be worth commenting on this for people who aren't familiar with hospitals and intensive care units. So you can see there that she's intubated and ventilated. And you can also see that she has mittens on her hands, which are to prevent her from pulling lines out of her or pulling the ventilation tube out, because that's a risk when you're comatose, delirious, and verging in and out of consciousness. And then very interestingly, you can see at the ankles there, on both legs, she has kind of pressure relieving sponges or whatever at the back of the ankles. I think that's to prevent pressure sores, but also probably to help orient the ankles and the legs more naturally. But I'd say that's more for pressure sores. And then obviously she's lying up at what looks like about a 30-degree angle, which is pretty common. But that's what we're seeing there. Scratch that. It isn't a mitten, it's a splint on the right arm, because she must have been dystonic with the right arm during her 5-day ketamine coma. Also, you can see that she had a towel in between her right and her left knee. That's again to prevent pressure sores. And in the last shot there, she had a pillow in between her legs, and that's again to prevent pressure sores. And you can also see what looks like a strap from the bed rest to her right arm to again prevent her pulling out her ventilation tube or other lines.
Now, having been through all that, was it worth it?
Yes. Helped a lot.
Yeah, helped a lot, especially with the headaches, if I understand
her
correctly.
headaches are a lot better.
Yep.
They're minor now.
Right.
Her pain in the legs is better.
Right.
So, yeah. So
Right.
It's all better.
So let's do some testing on you here, Maya. Are you ready for that? Okay, take that right hand, put it behind your head. You couldn't do that. No way before. Any pain when you do that?
Not really, no.
Not really. Okay, now do the other side, please. Again, you couldn't do that before. And we talked about how important it is that you...
Ketamine is a medication primarily used for anesthesia during surgery. It's a dissociative anesthetic, which means it can make a person feel detached from reality. However, research has also found that it has potential benefits in managing chronic pain, including complex regional pain syndrome. CRPS is a chronic pain condition, most often affecting one of the limbs, usually after an injury or trauma to that limb. It's believed to be caused by damage to or malfunction of the peripheral and central nervous system. The reason ketamine might be effective in treating conditions like CRPS is due to its ability to block NMDA receptors. NMDA receptors are involved in pain perception, and when overstimulated, they can increase the sensitivity of the body to pain, a phenomenon known as central sensitization. This is thought to play a key role in many chronic pain conditions, including CRPS. In high doses, ketamine has been shown to reset these overactive NMDA receptors, reducing their sensitivity to pain signals. Some studies suggest that using ketamine in a medically induced coma can help reset the nervous system and alleviate the symptoms of CRPS. During this procedure, patients are put into a ketamine-induced coma for several days, during which time they receive high doses of ketamine. However, this treatment is still considered experimental, and it's important to note that it's highly controversial due to the associated risks. Ketamine comas can have serious side effects including hallucinations, severe nausea, high blood pressure, and potentially life-threatening damage to the heart and lungs. The efficacy of this treatment method for CRPS is still being researched and debated in the medical community, and it's not widely accepted or available.
When we got back from Mexico, we couldn't afford to keep up with Dr. Kirkpatrick's treatments. So he recommended his colleague, Dr. Hannah, who took our insurance and prescribed low dosages of ketamine for Maya. She went back to school, to laughing and playing. We were just blessed that we finally seen something working. And for a year, it did.
That's really wonderful to see. That's one of the most gratifying things you can get in medicine, when you've got someone who comes to you in pain, whether it's physical or emotional or mental pain, and you treat them and then they recover somewhat or fully. It's great to see her doing better.
Until the night of the hurricane, she started complaining of pain in her tummy. And it got to the point where she was screaming and crying and begging for help.
What are your thoughts on the fact that she relapsed, the same day that there was a hurricane landing in Florida? I think there's a psychological element.
Yeah, it strongly argues for a psychogenic element related to stress, whether stress that she's experiencing directly or stress that she's experiencing communicated by family members because of the hurricane. But it's very difficult to argue that when you have a relapse which is temporally related to such a major event, it's very difficult to argue that they're completely unrelated, especially with something like chronic regional pain syndrome without an antecedent injury, which is what she has. I think a lot of the 10% where there's no injury, yes, there may be some autoimmune element there, but I think a lot of them have a psychogenic element as well.
I remember pulling up at the doors, go to triage, and then you get the same questions again. The first nurse in triage had no idea what CRPS was. And then the other ones as well. They wanted information and asked. And that's when I got my wife on the phone and she talked to the doctor.
The payments are low-dose naltrexone and ketamine oral prescribed by her doctor.
Her concern was merely administering ketamine over and over, more and more and more.
Beyond.
And this is a valid concern. If ketamine infusion isn't part of the protocol in the hospital you work in, it can be very difficult to prescribe it. It can be very difficult to get nursing staff to prescribe it. It can be very difficult to ensure that you're legally covered against any side effects. And so for any kind of experimental treatment like this, it can be very difficult to access care locally, especially in emergency situations. And this is what we're seeing here. No doubt the fact that she was on ketamine raised the level of caution and concern amongst the medical staff before anything else even happened.
It shows up an hour later.
She was belligerent, demanding.
The mom was very controlling, and she told me, this is what you're going to do.
Beata's explaining to them this is what needs to be done for the disease.
You don't understand her medical diagnosis. You don't understand how much medication it takes to control her pain.
But they just didn't understand.
There are risks of respiratory failure, cardiac arrest. Her daughter could die from this, and it didn't seem that she was, worried about that.
I remember I was in a great deal of pain.
Was the pain in your stomach, or was it in your foot? Was it all throughout your body?
My stomach, mainly. I was sent to the ER, and then after that, I was transferred to the PICU, or whatever that was called, the intensive care unit or something.
PICU, P-I-C-U, is Pediatric Intensive Care Unit.
That's most of what I remember.
They started Maya on low-dose ketamine, but that wasn't working.
As the days progressed, we did not feel that we were making any effect to Maya's status. In fact, we began questioning the diagnosis of complex generalized pain syndrome.
Beata knew that low dosage wouldn't do it. But they didn't listen.
At this time, things started becoming belligerent. Things started becoming talks of leaving the hospital. That's where I started feeling unsafe about Maya.
We were told if we plan on trying to leave, that security would be called.
And if you have a suspicion of child abuse, well, then you're required to contact Child Protection Services.
Yeah, this is something I've seen many times in my career. The conflict between quote unquote demanding parents in the view of the medical team and parents who are acting in the best interests of their child and feel the medical team doesn't understand it, isn't giving them the right treatment, doesn't have the right diagnosis, and it's their job to fight for their child so their child, doesn't feel pain, doesn't feel distress. And the more they fight, the more the medical team feel that they're difficult and belligerent and demanding. And the problem, of course, is that sometimes the parents don't have the best interests of the child at heart. And when looking at a documentary like this, it's easy to forget all the other times that those doctors had concerns and they were right, because this only shows this one incident. With that said, The ICU cardiologist is right. Once you have a concern that the child is being abused, there's a legal obligation on you to report it. And so once they started documenting that they had concerns about this, and this is why they were treating the family in a certain way, they then had a legal obligation to report it. And once you report it to Child Protection Services, a whole different mechanism comes into play and everyone loses control of what happens. And I've seen Child Protection Services completely underreact to really serious concerns that I and others have had, and then seen them completely overreact to other reports, which we thought were extremely minor. It really is Russian roulette when you refer someone to Child Protection Services, as far as I'm concerned.
A couple days later, I was visiting Maya at Johns Hopkins. At one point, the nurse walked out of the room, and in walked this woman with dark hair.
State your name for the record.
Sally Marie Smith.
She never stated who she was. She just walked in, looked at me, looked at Maya.
She came in and she acted like a regular doctor that worked for the hospital.
And she started to ask questions.
If they would have known who she was, we would have never spoken to her.
She asked, what's wrong with Maya? Where is she being treated? About medications. How could I let somebody give such high dosages? And I told her that's what the doctors prescribed.
Dr. Hanna, I have 55 infusions here ranging from early January to October 6th of 2016. I also understand that you wrote several prescriptions for oral ketamine to be used at home. Do you remember doing that?
Yes.
Is it possible, doctor, that the abdominal pain was caused by these infusions?
I mean, it can be a side effect.
Well, he was giving the child 1,000 milligrams at a time, day after day after day after day. That is not routine ketamine dosing.
There were multiple physicians, including as documented in the report to the abuse hotline, who had concerns for Munchausen syndrome by proxy. Munchausen by proxy is a form of child abuse in which a caretaker provides false or exaggerated information, ignoring medical recommendations, and that pattern of behavior causes harm to the child.
She did a 10-minute interview at most, and shortly after, she walks out.
There was ample evidence to support a diagnosis of medical child abuse, and it appeared most likely that Mrs. Kowalski was the primary one who was perpetrating the child abuse.
The nurse walks back in that was helping me. She told me I had to leave, that my daughter is under state custody.
I had a case of Munchausen's by proxy in a roughly 18 to 20-year-old male, again from the mum. But the investigations we did, we investigated over the course of about 6 to 8 months with several periods of hospitalization, liaison with neurologist, liaison with a GI specialist, a pain specialist. This person also had chronic regional pain syndrome, supposedly, and they were attending me for query psychosis, which they absolutely didn't have. But even then, after about 6 to 8 months, I started feeling that I had enough evidence to raise it with the family as a strong possibility. And then when I raised it, they defaulted from the service, moved to another area, and came under the care of another doctor who then later, on receipt of my notes, diagnosed Munchausen's by proxy. But a minimum of 6 to 9 months process was gone through there, with incredibly extensive collaterals from family, treating doctors going back 5 years or more. Even sitting down with someone for a full 8-hour day, I wouldn't feel that I could diagnose Munchausen's by proxy at all. A short conversation followed by this diagnosis seems very brave and questionable decision making.
They accused her of over-medicating Maya. And they thought Maya was faking this syndrome.
I explained to both Jack and Beata these types of cases are actually very common. Child Protective Service investigators have incredible power to remove children. All they have to prove is that there's probable cause that there could be harm to the child. In Florida, the child welfare system is privatized.
Yeah, this is what worries me about Child Protection Services. The bar of probable cause that there might be harm is actually really low. If that was the bar that I used for my patients in terms of them harming themselves, that there is more than a 50% chance that they might harm themselves, I would be admitting 10 patients a day, as opposed to 1 a week from my outpatient clinic. Obviously, they go in other ways. And the idea that your Child Protection Services agency is privatized and for profit is bizarre, highly questionable ethically, because you're not aligning your rewards in that system with the goals of the system. If the goal of the system is to have the safety of the children maximized, but the goal of the company is to maximize profits, those two goals aren't aligned. And whenever you have goals which aren't aligned, one of them gives way. Either you optimize patient care over profit, or you optimize profit over patient care. And if you're a private company which wants to make profit, we know which of those is going to be deprioritized. This is the sort of stuff that makes me so glad that I don't practice in America. I don't think I'd be able to square my ethics with American medicine at all.
So when Sally Smith reviewed Maya's case, she was an employee for the Suncoast Center. That center assists in investigating child abuse allegations in Pinellas County, where All Children's Hospital happens to be located. Children in Pinellas County are almost 2.5 times more likely to be removed from their families than the state average. I now refer to it as the child welfare industry. Any parent who's bringing their child with an unusual illness can be accused of doctor shopping and exposing the child to unnecessary medical procedures to fulfill their own mental health issue.
So, what was your personal assessment of Beata?
I think she could be a little too direct sometimes, and maybe some of the doctors took that offensively. I believe somebody at All Children's Hospital was offended and a conflict started.
Yeah, I think that's really an important point to bring up. Patients and families are allowed to be upset. They're allowed to disagree. They're allowed to be a bit demanding, although that's not perhaps the best term for it, but they're allowed to advocate strongly for what they want. It doesn't mean that they're always right, but it also doesn't mean that they're being abusive. It just seems to me that there maybe isn't as much of a tolerance for people questioning these doctors as I think there should be. Doctors are fallible. We're all fallible. I make mistakes. But admitting them is a really important part to good, safe medical practice. If you won't admit your mistakes and you won't be open to other people's points of view, you don't get as much information in, and then you end up making bad decisions. This is really scary.
Just you wait.
What, do you mean it gets worse?
It gets a lot worse.
Jesus Christ. I'm so happy I don't live in Florida.
As soon as I was made aware that Sally Smith was investigating, I called her immediately. And I explained to her, this is what the diagnosis is. If you want to see the objective evidence, I got it for you. I told her that on the phone. She writes a report 2 days later. Does she include that in the report? No.
I presented the information to the best of my professional ability and came to a conclusion.
I told her that if she goes forward with this, it would not only be a catastrophic outcome for the child, it would be a permanent injury to the whole family.
Did he warn you that your investigation could result in needless and permanent harm to the child and family.
I don't know if he specifically said that. I know he documented something some days later about our conversation. I read you what I wrote down.
This is a bit weird. If you're doing investigations, it's so that you get all of the information so that you can look at it holistically and come to the right decision. It isn't about looking at only some of the information and ignoring other pieces. If the doctor treating Maya sent her information about his treatment plan and justifying it, then that should have been given quite a lot of weight. I would certainly give that an awful lot of weight, because that's the person prescribing. And if that person is prescribing and isn't under undue influence of the mother, then it makes it very unlikely this is maternal medical abuse of the child. And this is really strange stance to take.
I certainly will acknowledge that investigation and medical evaluation for child abuse and neglect may cause some distress to a family.
Is that how you would classify what happened to the Kowalskis? Distress?
I don't know. You'd have to ask them how they responded to the whole thing.
I was wondering if I can speak with Maya.
I double-checked with social work, and she said you can't speak to her until after the court date tomorrow.
So I cannot even speak with my daughter.
No, I was told I can give you an update telling you how she is, but not tonight. You can't talk to her tonight.
This again strikes me as very strange and needlessly restrictive. Yes, if there's a concern of parental child abuse, you wouldn't want the parent to be speaking to the child unsupervised. But there's no real reason why you couldn't have the parent speak to the child by speakerphone and have it monitored by staff. And is that ideal? No, of course it isn't ideal from the point of view of their privacy. At the very least, you could offer that as an option. And I've certainly done that at times when we've had concerns that someone might be under undue influence. We've said they can have monitored visits or they can have monitored phone calls and so on and so forth, rather than just disallowing them entirely. Because that's very distressing, especially if you're wrong. Because if you're wrong and you prevent this contact, you're seriously damaging the mental health of the child and the parents. And that can end really badly. I've known patients who've killed themselves when being accused of these sorts of things or thinking that they might even harm their children.
Beata was focused on Maya's care.
If my daughter requests to speak with me, I want to be able to speak with her.
But my approach was not to cause any more tension between the hospital and our family.
They're gonna hold this against you. Stop this bullshit now! I want to see my daughter again! Don't do this! Don't talk about pain meds! Don't talk about this and that! You're gonna cause more problems! I want to see my daughter again! Don't do this shit!
Stop yelling in front.
You don't get it!
Come here. No, you don't get it. I can ask any question I want.
No! They're gonna hold it against you! I guarantee it! You're harassing her! Leave them alone! Don't blow
I love you, Mommy. But can you please not do what he's saying? Could you please? Please listen to Daddy. Not try.
He's not always right.
Yeah, this is the terrible bit. Jack is right. The dad is right. When mum is phoning up like that, the nurse is going to document everything she asks and says. And when mum is saying, oh, I have the right to do this, I have the right to do that, that can be documented in a way which looks very abusive. Mum is demanding this, mum is demanding that, mum won't listen to us boundarizing her. Mum is seeking to dictate treatment and all of that kind of stuff. And the problem is, if mum is conducting Munchausen by proxy, it's very important to document those things. But if mum isn't documenting those things when you have a certain view, you can really document them in a slanted way. That's why it's so important to just really document the facts of what happened. But yeah, the dad is right. I'm sure the way that was documented was an attempt to breach boundaries, an attempt to violate court instructions and Child Protection Services instructions. I've seen it happen myself. I've had to instruct junior doctors and nurses on how they document things and documenting them in a neutral way rather than allowing their personal opinions to shade how they're documenting things before. I can just imagine how that would have looked the next morning when it was documented. Probably brought to the court the next morning as the last nail in the coffin as well.
Our family was falling apart.
This witch today, she told me, you're giving her the ketamine at home IV. I said, I have no clue who told you that, but now this liar and this freaking asshole reported. I can't help it. I'm fighting for my child. How should I feel?
I think it would be really important for you to be calm.
Especially because they got upset with you, Yada. I can establish that you were just following doctor's protocol. I mean, there's nothing to show that you're making up a disease and that you're exaggerating her situation.
All right.
The advice I got there was really on point. It's the advice I give to any of my patients when they're involved with legal issues, whether it be about themselves, their children, divorces, etc. It's that, yes, this is personal to you, but you've got to be strategic when you deal with this. You've got to be really strategic. You've got to be really calm. You're playing a role for the courts to show that you're the most reasonable person there who abides by all of the medical advices and aren't flying off the handle, screaming at people or anything like this. And unfortunately, and you can understand why, Mum in this situation was clearly beginning to be emotionally overwhelmed and was approaching it from an emotional what's right point of view, as opposed to a strategic, what can I prove dispassionately in a court of law point of view. And she probably harmed her case, unfortunately.
They will have the Child Protection Services investigators preliminary report and have layers and layers of hearsay. This doctor said this doctor said that. It's all admissible. So it's easy for them to win, and it makes families very vulnerable to the system.
I've also been provided a copy of the Child Protection Team medical evaluation, which appears to be a preliminary report. I think in light of the allegations, it is appropriate that a no contact order be issued at this time between Mother and Maya.
Maya was placed in Child Protection Services custody at Johns Hopkins All Children's Hospital. Her treatment regimen was changed because they said that Beata had Munchausen syndrome by proxy.
The judge said that Beata had to go for psychological evaluation.
Beata had a psychological exam done, and the findings were that she did not have Munchausen syndrome by proxy, but she had an adjustment disorder with depressed mood from having her child taken away, and naturally by being attacked by the system.
Yeah, no shit, Sherlock. Unless Mum is a psychopath, she's going to have an adjustment disorder to having her child removed from her under spurious circumstances. Well, this just makes me despair of the setup of this system in Florida.
Beata, this is the thing you need to understand about these cases. They're not fair. They don't care about evidence. I've done 60 of these cases from the parent perspective, and cooperating is the best way to get your kid back.
Okay, but I'm gonna stop you here for a second. They told me every day that they have no idea how to treat this condition, and I want my daughter to be treated.
Now, I'm sure all of that is true, but once the case has already started, none of that really matters anymore. Judges don't care about whether the hospital was wrong nearly so much as they care about whether or not you're going to put your child in danger. Because the judge's only concern is, if I send this kid back to mom and dad, are they going to kill her? That's why the best way to get this case to end successfully, in my experience, is to convince everybody that you have changed your mind and that you are going to do what they tell you to do. And then when you get your child back, you leave that hospital and you never, ever go back.
So in the meantime, I'm gonna let my daughter deteriorate more.
Well, what other option do you have? Either she suffers now for a little while and eventually you get her back, or she suffers forever and you never get her back.
I see.
Yeah, that's exactly the discussion I've had with people. You need to be strategic. It's not about fair. It's not about right. It's not about any of those things. It's about the fact that the judge will only get in trouble if they send the kid home and you harm the kid. If they give a no contact order and they keep you away from the child for a year, they won't get in trouble. The odds are stacked against you. You have got to show them that you've seen the light. You're going to be a good little sheep and do exactly what they say. And that's your best chance for getting the kid back. And then once you get the kid back, you can do whatever the hell you want. But the system sucks sometimes. By the time parents are so distressed, they don't listen to that kind of advice. They have to sacrifice in the short term in order to gain in the long term. Better to have Maya suffer for a week or so in hospital and then afterwards be able to take her wherever the hell they want for whatever treatment they think is necessary, than to have her completely taken away from them, the mother-daughter bond break down, mum head for what sounds like a major nervous breakdown, possibly with self-harm, and dad and mum may be breaking up.
There was a time where I was finally allowed to go see Maya, but there's a lot of rules that I had to follow. I wasn't allowed to ask how she was doing, about her treatments. So when I come home from visiting Maya, Beata wanted to know how her little girl's doing. She wants to know if they're doing procedures or giving meds and this and that, and I couldn't say anything. You know, I can't. If I start doing that, I'm going to lose my privileges as a father to go see my daughter. And our daughter needs somebody to come see her.
It strikes me that we haven't seen mum yet, and either they're saving her up for a reveal closer to the end or something like that. But it strikes me that A, the parents' marriage is going to be significantly endangered by this boundary that's been put in place with them. But the question I have, and I know you're not going to answer me on this because I have to watch this blind, but I'm beginning to think mum isn't appearing because mum is self-terminated. We'll see.
So I'd stay quiet.
Kyle, did you have a chance to visit your sister at Johns Hopkins All Children's Hospital when she was hospitalized there?
Yes.
How did your sister appear to you when you would go visit her at the hospital?
She appeared like she did not want to be there.
It was hard for me to be without my parents, and it was hard to put all this trust into people I didn't even know.
They even said that it's all in Maya's head. The kid's sick. She's trying to tell people what's wrong with her, and nobody's listening. That's incorrect. I know my daughter.
The problem with that, and I have no doubt that they did see Maya use her feet to push herself several feet in the wheelchair in her room. But the problem with that is that just means that there's a psychogenic component, there's a psychological component. It doesn't mean, or it doesn't differentiate between it being Munchausen by proxy and some form of conversion syndrome or somatoform disorder or so on and so forth. So again, it doesn't prove medical child abuse. All it proves is that there's a psychological component. It seems to me that they're jumping from there's a psychological component to, and therefore it must be Munchausen's by proxy. And that leap is a very long jump, which may not be supported by the evidence, well, which isn't supported by the evidence I've seen so far, albeit that obviously this is a Netflix documentary and it's presenting the evidence with whatever the bias of the documentary is.
Do you think that she improved from the time that she was admitted to JHACH?
Yes. She gained weight. She was weaned off numerous medications. She was no longer having abdominal pain.
From the time you came into All Children's, did your pain ever improve?
No, not really. Like, I was in constant pain, and with CRPS, when it's left untreated, like without medication and without the proper physical therapy, also without a support system, that definitely plays into it, but it's like almost impossible to improve. So even though doctors came in and out of my room, I was never listened to. I was basically ignored.
5 minutes or 2 minutes, that's all it is. This was not the first time I've seen this type of scenario. After a few days at the hospital, they refused to give her ketamine. And without the high-dose ketamine treatment, she had virtually no mobility in her legs at all. And that's where you get these blood clots forming, which can break off, go to the lungs, and it could be fatal. And I felt it was important that Beata understood the seriousness of this. So I warned her, in all medical probability, that Maya would die a slow, painful death.
Hi, Beata?
Yes, this is Beata.
Okay, I have Maya on the phone.
Okay, I just wanted to review the roles so I don't say anything wrong.
Basically, no discussing case. Just keep it like her activities and how she's doing and, you know.
Okay.
Go ahead and start talking.
Hi, Maya. How are you, honey?
Hi, Mommy.
Hi, how is my sunshine today?
I miss you so much, Mommy.
I do too, sweetie pie. I do too. I miss you so much. We just have to be patient, okay?
Alright.
How did you sleep last night?
I went to bed at 2.
Wow. You couldn't fall asleep?
No.
Are you alone in your room or is Kathy sitting by you?
Miss Kathy is sitting by me.
Are you alone in your room or is Kathy sitting by you?
Miss Kathy is sitting by me.
Ooh, don't do that. Once you ask if someone's sitting by you, what they will immediately do is document that Mum checked whether there was anyone there, presumably so that if there wasn't someone there, Mum could breach the court order. Just doing that is just handing them a gun and loading it with ammunition and pointing it at your own head. That is just not the way to play this.
One social worker at Johns Hopkins All Children's Hospital was assigned to my daughter.
Please state your name for the record.
Catherine R. Beatty.
Something didn't seem right with her, so he Googled her name. The first thing that came up was she was arrested for child abuse.
Oh my God, that's the best thing ever. Yeah. What you really want is someone who's been charged with what? Placing both knees on the boy's chest, and then when he can't breathe saying, yes, you can. You want them to be the person accusing you of abusing children. Wow. Wow. That is interesting. That's just bizarre.
Kathy Beatty told me that I was going to go into a foster home. She told me that my mom was in a mental institution. She told me that she was going to end up adopting me.
She was going to end up adopting her?
Yeah.
Kathy Beatty?
Yes.
That's unethical, firstly. But surely that's illegal. You can't adopt someone whose own case you worked on.
I don't know if it's illegal, but lying to her is...
Oh yeah, it's unethical. The number one rule of everything is you can never lie to a patient. You just can't. If they ask you a direct question, you have to give a direct answer. Wow. That'd be a great job though if you wanted to adopt a kid. Become a social worker, find a kid you like, accuse the parents of child abuse, take the kid, and then adopt the kid yourself.
Do you remember being told why they wanted to take photos of you?
Yeah, Kathy Beatty came over to my bed and she was like, if you want to go to the court hearing, I have to do this.
So risk management made the decision to have these pictures taken of Maya?
Yep. She removed my clothes.
She was in her sports bra and a pair of shorts.
Held me down, took photos of me.
We took pictures of her arms, her legs, her face, and her stomach.
I was screaming, crying, yelling no.
She did not want you to take pictures of her like that, did she?
She did not.
I could not have made it any more clear.
But you went ahead and took pictures of her anyway.
Unfortunately, we did.
What steps were taken to call the parents and ask whether you could take pictures of their child like this?
We can call the parents.
If it was risk management in the hospital, they wouldn't have the right to mandate that being done. My understanding is the court would have the rights, or a duly appointed officer of the court or someone they've delegated decisions to would have the right to say she needs this done. But if the hospital just did it on its own bat, that's an incredibly traumatic experience for a young child.
Yeah, considering especially they're accusing the parents of putting her through medical trauma.
I know. To investigate the medical trauma, we're going to strip you almost naked and strangers are going to take pictures of you.
Yeah.
Jesus. There has to have been a better way to manage that. There just has to have been. Maybe they had to take the photos, but holding her down and forcing it in such a way with no consent from anyone or no calming words from parents, that's not the way to do this.
Hi, Maya. How are you, sweetie pie?
I'm really not feeling well.
You're not feeling good?
Everything is hard for me. I cry a lot.
So the tramadol doesn't do anything for you?
No, not at all.
What else are you getting for pain?
Nothing else.
Oh, I'm very sorry, honey. I wish I was there to rub your back and hug you.
Yeah, me too.
Have you been able to talk to your attorney?
Yeah, he's gonna come today.
Oh, good. I just want to make sure that you are able to talk to. How was your Thanksgiving?
It wasn't really good.
I know. It was the worst Thanksgiving ever for me.
I don't understand why this happened, you know?
Yeah, it's very difficult. It's very complicated.
I mean, nothing's happened wrong and we're separated now.
I know. I'm very sorry, honey. Very sorry. Just be strong, okay?
Yeah.
I pray for you every day.
Me too.
So be strong.
I'm trying.
Okay.
Mom, we have to say goodbye. I have to step into something else right now.
Okay. Thank you, Maya.
I love you, Mommy.
I love you. Bye-bye.
Bye, Mommy.
Yeah, that phone call is just really heartbreaking to listen to. And what strikes me there is that Mum was suffering from an adjustment disorder and depression, or a depressive component to it anyway. And it just strikes me that a depressed person could look at this situation and say that they are the reason that Maya can't come home, because they're the one accused of Munchausen by proxy. So if they remove themselves from the situation by either leaving the family home, or I'm beginning to think is much more likely that happened, by self-terminating themselves, then Maya will be able to come home. And so I could easily foresee that Mum would form a train of thought whereby the best way to stop Maya's suffering was for Mum to kill herself, so that Maya could then come home to the father and the brother. And so looking at this now, I doubt it's a case where things end happily, and I doubt it's a case where Mum and Dad broke up. I'd say that the longer this dragged on, the more likely it is that Mum decided the way to get Maya home was for Mum to die. And I'd say Mum self-terminated. It's really sad. Yeah, but I haven't seen exactly this, but I've seen stuff close to it before.
I don't know if it was questioning Maya on her treatments or what they're giving her and certain things that she can't discuss with her daughter. But unfortunately, Kathy Beatty accused Beata of being inappropriate during that phone conversation. And she tried to get Beata's privileges suspended. Beata, as strong as she is, it just destroyed her.
Could you tell me a little about you and your wife's relationship?
No, it's like any marriage. You got your ups and downs, I'm sure. You're not going to agree on everything.
Is Maya looking for some attention from her mom? Trying to please her mom? Mom wants her to be sick, so I'm going to be sick to please my mom?
God, I hope that.
So let's not differentiate love and affection and caring for abuse, because they can happen in tandem.
Yeah. I don't agree with her on a lot of things, but I'll tell you what, intentionally, she would never hurt her children. I swear on my life on that one.
It could be very possible that someone could be looking at criminal charges. Which is why I'm asking you, are you protective or are you complicit?
Are you protective or complicit? Where is the third option of Beata isn't doing this and your mother and father pair struggling to get through a really difficult situation as best you can? It sounds like people's minds are already made up.
Yeah, and he's not really coming to her defense in this interview either.
No, if you knew what this was about, you would go, no, my wife wouldn't do that. You wouldn't put in the clause of intentionally and so on and so forth.
That she's a very pushy person.
Yeah.
God, I hope not.
But you know what this is? And I see this all the time. This is a person, in my estimation, who doesn't realize the import of this chat they're having. Doesn't realize it's an interview that's, being used for a criminal investigation. And it's just, look, I know we didn't abuse Maya, so I have nothing to fear. But the reality is, anytime you're talking to the police, you do have stuff to fear, because they can twist what you say whatever way they want, and you need to be very careful. And him sitting down with that detective with no lawyer, etc. present was, unfortunately, incredibly naive.
Number one, never talk to the police without a lawyer.
Absolutely. Yeah, absolutely. I'm instituting my right of silence until my lawyer gets here. Thank you very much. Goodbye. Yeah, he just thought this is a chat. I'm going to be honest. I have nothing to fear. And the thing is, 1, it wasn't a chat. 2, he did have something to fear. And 3, being radically honest is not necessarily the best way to go there. Being honest is good, but being strategically honest is probably the way to go there. Yeah, he was naive, but that's not a crime.
Are your children truly your first priority?
I swear on my life, on my children's lives.
I don't care. I'll put you and your wife in jail tomorrow if
I did
Maya
something
gets
wrong,
better.
you put me in jail.
Absolutely.
Yes, I accept that.
Let me ask you, if Maya was released tomorrow, would you be compliant if that child was not to have any contact with her mother?
Yes. In a heartbeat.
So did they want Jack to turn on Beata?
I would assume that they did. That would have made their case easier.
He said that he would choose his kids over his wife.
That's what he's supposed to say. If you say otherwise, it will be held against you. That is the only correct answer.
Yeah, she's absolutely right. The only answer you can give then is, I prioritize my children over everything else, including my relationship with my wife. If you don't say that, you are going to be lumped into the facilitating abuse basket, and you'll never see them again, because they'll say that you'll break the court order. Jesus.
Miss Beatty, you'd said before you thought Maya was happy and thriving under your care and the care of the hospital.
Yes. Maya was moving her legs, moving her hands without any pain. She was out playing the piano downstairs and often moved herself around the hospital. So we saw her getting better.
With all due respect, she's a social worker. She isn't a specialist in diagnosing these things and assessing these things. It may not have appeared that Maya was a typical case of complex regional pain syndrome, but atypical cases present all the time. That's one of the hallmarks of CRPS.
Can I ask you one other question?
Sure.
Is there any way that even just momentarily she could just see her mom just to like hug her mother?
I'm afraid not. Not today.
There was a scream that I'll never forget. It's my name in Polish, Jacek. He screamed that so loud, I knew.
911, tell me exactly what happened.
She hung herself in the garage.
Yeah, that's just horrendous, but unfortunately not unexpected. You can only push people so far before they break. And another kid's birthday party reminding her of Maya, not being able to see her, not being able to attend parties with her. And then, of course, my supposition that there's a cognitive process there as well, thinking, if I'm the reason Maya can't come home, if I'm not here, Maya can come home. And it ends in this irreversible tragedy for the entire family. It's really sad to see.
It's compounded by the fact that this happened January 8th, so right after Christmas, right after New Year's.
Christmas, New Year's, yeah.
The daughter.
A long couple of weeks of families spending time together, children being happy, all those gift giving, which I'm sure was denied. If you're not allowed to give a hug, I'm sure you're not allowed to give a gift. It just seems needlessly restrictive, cruelly restrictive. Like, Maya's safety, I don't see how Maya's safety would have been compromised by a very clear, all you can say is I love you, give a hug, 10 seconds and leave. There are ways around this without being so
And denying these
draconian.
things does so much greater harm.
Yeah, that's the whole point. It's risk benefit, and the potential harm can be mitigated by people being there, clear ground rules, etc., etc. And yeah, if the person breaks the ground rules, then yes, you say, no, you can't be trusted. We won't let you do it again. But yeah, it just seems that there must have been ways to mitigate the risk. And it just was needlessly restrictive. And this is the sort of stuff that ends up happening when you do that. When you don't treat people like people, terrible, terrible things can happen.
I think the note that Beata left for Judge Hayworth makes it pretty clear that she wanted her child to be free from that hospital. She was very worried about what was happening and the treatment that she was being forced to take. She wanted to make sure that her child got out of there. And she didn't see any other way out.
Shortly after Beata's death, they allowed me to take Maya to go see a specialist in Rhode Island, Dr. Chopra. He did an evaluation on her, which did confirm that she does have CRPS. And he sent his report to the court. Not too much longer after that, Maya was released to my custody.
There's an old saying in medicine, which is doctors differ, patients die. In this case, it's doctors differ and the patient's mother dies. It's just horrendous.
Maya, we are so excited to see you. So thankful you're home.
After Maya was released in 2017, I had to follow certain instructions from the court. She was not allowed any ketamine treatments, so we had to do things slow. It took over a year of physical therapy, and she went from a wheelchair to crutches. And then 1 year after that, walking around. But she still had pain, a lot of pain, and she could relapse anytime. It's very difficult to understand what went through Beata's mind, thinking that was the only way to get her daughter out. I miss her dearly.
I've been a reporter for over 5 years. I interviewed Dr. Sally Smith over the phone to get her side of the story. And Dr. Smith was extremely firm that she had done nothing wrong. But what I found out was that Dr. Smith's opinions differed a lot from other doctors. When I hit publish on that piece about the Kowalski family, that was when the calls started coming in and the emails started coming in. And I realized that this was a lot bigger than just the Kowalskis. I'm sitting at my desk and I start hearing from more and more families. People who had gone to the doctor for help for their kids and then became the target of the system. One thing that they all had in common was Dr. Sally Smith and Johns Hopkins All Children's Hospital.
She saw us for less than 10 minutes, and then my husband was arrested for aggravated child abuse.
We ended up arrested and in prison, and my children were in foster care.
I do almost all of the evaluations for children who are admitted to All Children's Hospital for the last 30 years. I'm a very reasonable, generally compassionate, caring person, and I don't set out each day to tear families apart.
Yeah, one of the problems of over-specializing is that if you become a specialist in a certain illness or disorder or thing, then that becomes something you see everywhere. And I once worked beside, but at a remove from, a doctor who was a specialist in bipolar affective disorder. And we used to joke that if you phoned his clinic with a wrong number, he would diagnose you with bipolar affective disorder, because there are generally recognized to be 3 main types of bipolar, 1, 2, and 3, with the third being medication or organic illness-induced bipolar. But this doctor believed that there were 8 types, and each of the higher number types had smaller and smaller differences from normal moods, to the point where the 8th type was if a woman was excited about her wedding, he would diagnose her as being bipolar. And that actually happened once. This poor bride, about a week before her wedding, wasn't sleeping and was super excited and super stressed, and she got diagnosed with bipolar, as opposed to what was probably a much more reasonable diagnosis of a moderate case of being bridezilla and being really stressed about her wedding and wanting everything to go perfectly. And isn't that very understandable? And give her a couple of sleeping tablets, let her sleep for a couple of days, see her before the wedding, and if she's still like this, maybe it is, but if she settles, it's not, and it's just overexcitement. But yeah, I just wonder if she's been doing this for 30 years. Is she ferreting out child abuse that maybe isn't there?
To go back to what you said before, multiple of these families are saying that she saw the patient for 10 minutes before making a decision.
Well, I was going to say that's unbelievable. It isn't unbelievable because I've seen this sort of thing happen, but it is unconscionable that a senior doctor, she's in American terms, I presume, a resident, or no, an attending. What do you call them?
Yeah, attending.
So in American terms, she's an attending. That's a senior doctor. You can't make a life-changing diagnosis like this, especially a very complex diagnosis like this about motivations and factitiousness and conversions and all of these sorts of things. You can't make a diagnosis like that in 10 minutes.
Especially,
I would take weeks and months to make that diagnosis.
especially something that's so life-changing and
Yeah.
impacts these families. Like these families are facing criminal convictions. They're facing
Yeah.
It's impacting the children's mental health.
And even earlier, they said this wasn't the first parent they had self-terminate. This is the thing. If you've had someone self-terminate, through this process, it just behooves you to examine your practice and make sure you're doing it right. Because self-termination doesn't mean they were innocent, for sure, but it's a pretty strong indicator that maybe you've got it a bit wrong and you should at least look at your practice. Nothing I've seen in this documentary where they've shown Sally Smith makes me think that she's that self-reflective. Now, admittedly, I'm sure they're cherry-picking the pieces, but she certainly comes across poorly so far.
You're not seeing her full perspective.
No. Hopefully we'll see more in the next half hour.
They would try to convince me that my mom was doing things to me, that she was making my CRPS up. It's complete nonsense.
You know what? We tried to cooperate. But nothing changes if you stay quiet. And we have to hold Johns Hopkins responsible for what they done. We want justice for Mom.
Beata was a nurse, not a lawyer. But somehow she knew what the hospital was doing. She documented everything. Every email, every writing, every phone call. And all of that documentation is the reason we can sue. Because when they come in and tell us a falsehood, we have the truth.
That's a good nurse. That's what nurses do. Nurses always document so much more than doctors. It's a bit shocking, although to be fair, good doctor's notes can be brief and still capture the point. But yeah, like the first kind of fallback of a nurse is to document everything that happens. The facts, and then their feelings about those facts. Yeah, I'm assuming this ends in a massive trial. And the hospital is going to regret that Beata was a nurse, because I'd say she has documented all of these phone calls, etc., far better than any other parent will have. This is what nurses do.
When I heard those phone calls, as a mother, I got it. I got the frustration of Beata.
Most families give up. Not because they want to, but because they're taking on a huge corporation and the state.
So most parents don't have the ability, the funds, the fortitude, or the counsel to fight back. So they enter into a case plan.
My attorney advised that it would be safest and quickest to take the case plan.
A case plan is where a parent chooses to go along with whatever the state requires of them, a checklist, if you will, to get your child back.
It's just simpler to go through the case plan, even if you're innocent.
However, if you go ahead and sign the case plan, you're releasing the hospital from liability.
But the Kowalskis didn't take a case plan.
That's a sweet deal for the hospital. Offer the family a case plan. If the family don't go along with it, they're just proving that they're difficult, and the child won't be returned to them for God knows how long, if ever. And if they go along with the case plan, which of course is what almost everyone is going to do, then the hospital is absolved of liability. That's a pretty sweet deal. I always say there's a reason it's called the practice of law, not the practice of justice.
And either way, the hospital takes home that.
Sweet money.
Yeah.
God, the American system is so terrible. I mean...
Because the longer you're in hospital, the more the hospital...
No, this is it. Like, under European socialized care, the longer you're in hospital, the more work you are for doctors. So we don't want to keep anyone in hospital. You know, I get paid for having good outcomes for patients. I don't get paid if they get this drug or that drug. I don't get paid if they're admitted or not admitted. There's nothing about that. Basically, I just get paid to see them and treat them. And if there's lots of complaints about my treatment, they'll probably look at my employment. But otherwise, I'm independently practicing within the parameters of the services prescribing and treatment guidelines and resources.
Recently, we started digging into the codes that Johns Hopkins used for billing the insurance companies. And we found out that they billed them for 3 months treatment for CRPS. The exact same illness Sally Smith was telling the courts she did not have and that the parents had made up.
Wow. Disclaimer, I'm not a lawyer, but if you're treating someone and saying they don't have an illness and you're billing them for that illness, that sounds like fraud to me. It really makes your case that they didn't have a CRPS really poor when your own billing system says we're treating them for CRPS. Wow. Oh, they are gonna make so much money out of this like lawsuit. And of course, one of the things I always say when a lawsuit is genuine is the person will trade it all in, all the money they win, they trade it all in for things to go back to the status quo before the lawsuit, like an injury or anything like that. When it's not genuine, I tend to find that the person is much more focused on how much they're going to get and all that kind of stuff. But like in this case, if they get 100 million, it's not going to bring Maya's mother back or Beata back. That's a yawning chasm in their life that can never be filled. Plus all of the trauma of, as Maya says, being medically kidnapped. But yeah, God, I'd say whatever settlement the hospital's lawyers were thinking of when they found the bit about like we've been billing for CRPS, they went, we're adding a 0 to the settlement. Yeah. Wow.
So, yesterday morning, we got an order telling us we could go to trial, and we were ecstatic. Then, around 1:30, we got the second order from the 2nd District Court of Appeals to stay the trial. So, we're not going to go to trial Monday.
The old line that justice delayed is justice denied seems very apposite here. Like delaying justice for 5 years here is inflicting a daily psychological, emotional trauma on this family. An awful lot of families, I'm sure, would just give up over the 5 years and settle, which I'm sure is what an awful lot of these hospitals and lawyers bank on, that they can just outlast financially and emotionally families like this. It's really sickening.
Even when cases had been dropped or overturned, the damage had been done. Kids had been traumatized. Parents had their reputations destroyed.
Even though my charges were dropped and I was found of no wrongdoing, I had people messaging me, telling me that I should kill myself, that my children deserved to be in foster care, and that they hoped that I never got them back.
I spent over 300 days in jail before they finally dropped the charges. They ruined my life because of it.
It's just a very scary feeling to know that somebody's words can be so life-changing.
There's a lot of pressure on child abuse pediatricians to be able to say definitively that this was abuse or that this was an accident. But these kinds of cases are way too complicated to be black and white. Often, they're in a gray area.
That's actually very true. And this is actually a place where society does need to bear some responsibility, because society puts pressure on people to say things definitively, which can't often be decided definitively. And then, of course, the lure is to give a definitive answer. And then often you're wrong. And there isn't often a lot of tolerance for, this is really complicated, and it isn't possible to be definitive, but the probabilities are as follows, or the facts I could establish are as follows. Everyone involved in this process needs to look at themselves. I think especially the doctors in the hospital, obviously. But I do think that if you pretend people can be definitive about things they can't be definitive about, then people who pretend that they can be definitive will become the experts in the field and make money by going to courts and saying, I know this without a shadow of a doubt, because that's the easy answer the court wants. And the people who say we can't know this, they won't get hired to be an expert witness the next time. And so they'll be winnowed out of the expert witness pool. I've seen that sort of stuff happen myself.
So when there is just one person whose word is like gold, opinions, interpretation, perspectives, bias starts to play in and starts to play a huge, huge role. And it could be a dangerous one.
Is there anything else we need to discuss today?
Yes, Your Honor. The Kowalskis are here, and they just wanted to speak to the court, if that's all right.
Well, it's a little unusual. Mr. Hunter, what's your thought?
Judge, I don't know where this is going. I don't think it's a good idea.
I think it's probably best to just leave it at that.
Justice delayed and now voices silenced. This is terrible. Imagine if you were these people. That's just terrible, especially for her. How old is she now? She's what, 16 or something like that? Probably,
Yeah.
5 years later. But she's not over 18. This is still a child who is learning that whether you're right or wrong doesn't matter. And unfortunately, that is a lesson that you do need to learn at some point in your adulthood. As I said earlier about her mum and being strategic and not letting emotions run. But learning it at this point in life, that's shattering. That's going to destroy her trust in all institutions. And some people might argue rightly, but how can she trust judges? How can she trust doctors? How can she trust hospitals? How can she trust social services going forward? That's terrible.
They don't give a shit.
Please stop talking. I don't want to hear it anymore.
It's never gonna end. It's never gonna end. It's never gonna end, Dad. Nothing works. I pray every single night. Nothing. It doesn't help.
That's just heartbreaking footage, and it would make you worry about the mental health of all three members of the family and hope that they don't actually do something very regrettable, because this is a very high stress situation. And I suppose one of the reasons they probably went for a documentary like this is that it's going to bring a lot of publicity to bear. Hopefully it'll make the hospital offer a settlement. Either way, this is something I want to cover again, especially if it goes to trial, because I think a lot of the testimony, the medical testimony, would be very impenetrable for people. And I think, I could probably add some value in interpreting that.
The kids are totally crushed. I'm crushed. It wears you out. But if we give up and shut our mouths, it's gonna happen again. It's just a matter of time.
The Kowalski family, they're standing up for these parents and trying to bring awareness to this issue that has been shrouded in so much shame and secrecy.
I've got to say, that's a pretty horrifying documentary. The sad thing is, nothing in it really surprises me. I've seen variations of it in my own clinical practice. Thankfully, not in things I've done, in things I've seen other teams do and Child Protection Services do, and that I have objected to. In fact, one time I actually went to a child protection meeting, and I went there because the patient had very severe psychiatric illness, and we were very concerned that they weren't giving her a fair shake, that weren't being fair to her. And so I said go and I'd advocate for what I thought was reasonable, not really for the patient, but just for what was reasonable and what could be proven. When we went to the meeting, the person who was in charge of the meeting went round the entire room to the teachers and the GP and police and social workers and everything like that, and got all of their information and all of their testimony about their concerns. And then she went to the dad, who was making allegations against the mum as well as part of a divorce. And then when she went to mum, she said, "Oh, I know you sent something in, but I haven't had time to read it, and I'll read it after I render my decision." which is basically like saying you're going to listen to the prosecution case, but not listen to the defense case. And it came to me, and every other professional in the room was saying, oh, we have concerns. And it was clearly, in my mind, being railroaded. And the type of person I am, I'm not going to sit there and take that. So I spoke up and I said I would have significant problems with the decision being made in the absence of reading her testimony, that if they were to do that, I would consider it an unsafe decision. I'd make a formal complaint about it. And that at the very least, they had to read her information and testimony before coming back. And the end result was that, yes, they didn't make the decision there that day. But what they then did was they stopped inviting me to other meetings for patients of mine who were going to Child Protective Services to make a case for keeping their children, which I, of course, found out about. So I then started showing up to these meetings or sending members of my team to be difficult. And by being difficult, I'm going, you need to follow the rules and procedures you lay out to be fair, and you can't just listen to the prosecution case and not the defense case. And actually then what started happening was I put in a complaint that they weren't inviting me. So they started inviting me, but they started sending the letter on the week of the meeting so that it wasn't possible for me to get the letter in time to go to the meeting, and all sorts of administrative things like that. And that's what these groups do. So yeah, in my local area, I am persona non grata to the Child Protection Services. They do not like me at all. But I don't have a dog in the fight of, does the kid stay, does the kid go, or whatever. I'm just interested in a fair process being followed and kind of justice being done. We've got to protect the child, but you can't do that by just finding every parent guilty. That's insane. Yeah, that can be very frustrating, actually, when you're a doctor. I had a case, and I can't go into the details for obvious reasons, but I had a case where mother went to the papers about the death of her son, which I don't think was a suicide. I think it was an accidental drowning. And she made a whole list of allegations about his treatment, which were really completely untrue and were demonstrably untrue given the notes. And we couldn't say anything about it, even though it was in national and local newspapers, because of privacy laws. With that said, I'm sure the family would give them a waiver for saying whatever they wanted publicly, but they probably aren't going to pursue that waiver, to be fair. So they got approved for punitive damages. The court date is set for September the 11th, 2023. Firstly, that the documentary clearly has taken a view of what happened and has had the ability to present a narrative which fits that view. While the narrative does seem compelling, we always need to be careful when only presented with one side of a story. Secondly, it's interesting that Maya improved without the ketamine infusions. It appears that rigorous physiotherapy and time proved ameliorative. This speaks to there being a significant psychological component to the complex regional pain syndrome. I do want to be clear that the fact that there was a psychological component in no way justifies a diagnosis of Munchausen by proxy or medical child abuse. It's just an interesting thing I reflected on after I saw the documentary, and something that might be clarified in any upcoming trial. I think there may be a lot of educational value in covering the trial if and when it does happen. Let me know if this is something you'd be interested in me doing in the comments section. On the left of the screen, YouTube is showing you a video from the channel you might enjoy next, while on the right of the screen I've chosen a playlist you may enjoy. Until next time, take care of yourselves and each other.